Direct and indirect capping. What is the difference between direct and indirect capping? In pedodontics, the patient will not be given indirect capping, will not be given direct pulp capping, because the pulp tissue and the pulp chamber of pedodontics of the pediatric patient is different than the adults and could be inflamed quickly. But we can use an indirect pulp capping in the pedodontics. When it comes to giving direct pulp and indirect pulp capping, we have to leave a small layer of caries above the pulp tissue in order not to expose the pulp to trauma, and then we cover the pulp with calcium hydroxide or dical and zinc oxide eugenol temporary restoration for 1 month, and after the month period a dentinal bridge must form above the pulp chamber, allowing us to remove the temporary restoration and dical, then do the indirect pulp capping. We cannot use the direct pulp capping for the pediatric patient for a simple reason that the pediatric patient tissue is different than the adult patient pulp tissue, and inflammation could spread rapidly through the pulp of the pediatric patient. Instead, we do indirect pulp capping. The definition of indirect pulp capping is not is a small exposure, or indeed no exposure to the pulp is being made. And the definition of direct pulp capping, or the procedure when we do the direct pulp capping, is there is a trauma to the pulp tissue. Therefore, caries teeth, about 70% of caries, 75% of deep caries teeth must involve the pulp in some way or another. And in this case, we must do direct or indirect pulp capping. We sometimes use in patients that are pediatric, it is very hard to do pulpotomy. Therefore, we sometimes use pulpectomy to the pediatric patient. In the patients that are in pain and have mobility of the tooth plus root resorption or abscess formation, the indirect and direct pulp capping is contraindicated. And patients that have no pain nor discomfort after 1 month of the exposure of the pulp and after 1 month of our temporary restoration, then they are indicated for direct and indirect pulp caping. The pulp caping is very necessary procedure, and it is different from pulpotomy and pulpectomy. The pediatric patients are very different from the adult patient, and a direct pulp caping is very difficult to perform to the pediatric patient. Therefore, pulpotomy or pulpectomy is indicated. In the direct pulp caping, there must be no clot formation, as it could interfere with our procedure and could form bacteria inside the pulp. Therefore, a pinpoint exposure without an excessive amount of blood being shown at the site of the exposure, plus the walls of the cavity should be cleaned and operated before the floor of the cavity to prevent caries from entering the pulp exposure. This pinpoint exposure is very necessary, that a small amount of blood is shown, and then after this pinpoint exposure we do irrigation with biocompatible agents like normal saline, or we have the anesthetic solution, and after that irrigation we clean the cavity and prepare it for the indirect or direct. This one is direct pulp caping, therefore we should prepare it for the direct pulp caping. As we mentioned before, 1 month of temporary restoration.